Let me ask you a quick question. Have you ever felt like your stomach suddenly turned into a balloon after a meal? You're not alone. Gas and bloating are incredibly common, especially seniors over 60. In fact, up to 30% of adults regularly experience bloating. And it's not just uncomfortable, it can really interfere with your daily life. Today, we're diving deep into the natural remedies that can help reduce gas and bloating, support digestion, and promote long-term gut health, without relying on harsh medications or expensive supplements. First, let's understand why gas and bloating happen in the first place. Most of the time, gas forms in your digestive tract when bacteria in your gut break down food, especially carbohydrates that weren't fully digested in your stomach or small intestine. Foods like beans, dairy, certain vegetables like cabbage and broccoli, and artificial sweeteners can be major triggers. Bloating, on the other hand, is the feeling of fullness or swelling in the abdomen. It's often caused by gas buildup, constipation, or even just swallowing too much air while eating or drinking. Seniors may develop sensitivities to lactose, gluten, or certain fibers. It can also be a sign that your gut microbiome, that vast colony of bacteria in your intestines, is out of balance. So now that we know the why, let's move on to the how, as in, how can we reduce gas and bloating naturally? Remedy number 1. Eat slower and chew more. Simple but powerful. Eat slower and chew your food properly. If you rush through meals or eat on the go, you're more likely to swallow air, which increases gas. Plus, poorly chewed food puts more pressure on your stomach and intestines. A study from the National Institutes of Health found that thoroughly chewing food not only supports better nutrient absorption but also helps reduce bloating. It's recommended to chew each bite about 20 to 30 times to aid digestion. This aligns with Dr. Barbara O'Neill's advice, as she highlights that slow, mindful eating and thorough chewing reduce the amount of air swallowed and enhance digestive enzyme activity, both essential for preventing gas and bloating. And while we're at it, put down your phone during meals. Being distracted can cause you to eat faster and ignore your body's signals of fullness, both of which contribute to bloating. Remedy number 2. Try a low FODMAP diet. Next up is the low FODMAP diet, one of the most research-backed approaches to reduce bloating and IBS-related symptoms. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, basically, types of carbohydrates that are hard to digest and tend to ferment in your gut, creating gas. Cutting back on high FODMAP foods like onions, garlic, apples, and wheat for a few weeks, and then reintroducing them slowly, can help you identify your personal triggers. According to research published in Gastroenterology, up to 75% of people with bloating or IBS see a significant improvement on a low FODMAP diet. Now, this one can be tricky to follow, so working with a registered dietitian is a smart move if you're considering it long-term. Remedy number 3. Herbal teas for gas relief. Want something soothing and natural? Herbal teas are an age-old remedy, and science backs their benefits. 1. Peppermint tea can relax the muscles in your digestive tract, helping trapped gas move more easily. 2. Ginger tea is anti-inflammatory and supports stomach emptying, reducing that bloated, heavy feeling. 3. Fennel tea has been used for centuries to ease digestive discomfort. A study in BMC Complementary Medicine found it can help reduce gas and cramping, especially in people with IBS. Try sipping a cup of any of these teas about 20 to 30 minutes after meals, and see how your body responds. According to Dr. Barbara O'Neill, a simple yet effective natural approach to reducing gas and bloating begins with stimulating digestion before meals by drinking warm lemon water or ginger tea combined with a pinch of cayenne pepper. This practice helps activate stomach acids and digestive enzymes, preparing the gut for efficient food breakdown. During meals, she advises adding digestive supportive ingredients like fresh ginger or garlic to dishes, which can reduce fermentation and gas formation in the intestines. Seniors always soak legumes overnight in warm water with ginger or garlic, and optionally lemon juice. This breaks down gas-forming compounds before cooking. Remedy number 4. Probiotics and fermented foods. Now let's talk about the gut microbiome, those billions of bacteria in your intestines that affect everything from digestion to immunity. When your gut bacteria are out of balance, gas and bloating can worsen. That's where probiotics come in. These are good bacteria found in fermented foods like yogurt with live cultures, kefir, sauerkraut, kimchi, miso. Probiotics help restore balance in your gut flora, improve digestion, and reduce gas production. One clinical review in the World Journal of Gastroenterology found that probiotics helped reduce bloating and flatulence, especially in people with digestive disorders. Start with small servings and see how you feel. Everyone's gut is unique. Remedy number 5. Movement and posture. Sometimes, it's not about what you eat, it's about what you do after. Experts often highlight similar aids that complement Dr. Barbara's tips. Light movement after a meal, like a 10 to 15-minute walk, can stimulate digestion and reduce bloating. In fact, one study in Diabetology International showed that walking after meals can help improve gas transit and reduce post-meal bloating. While magnesium-rich fluids can relieve constipation that often contributes to bloating. Also, be mindful of posture. Sitting hunched over compresses your abdomen and can slow digestion. Try sitting upright during and after meals, and avoid lying down immediately after eating. When to see a doctor. While gas and bloating are usually harmless, there are times when you should check in with a healthcare provider. If your symptoms are persistent or getting worse, accompanied by weight loss, vomiting, or blood in stool, or if they significantly affect your quality of life, these could signal more serious conditions like celiac disease, SIBO, or even ovarian cancer, especially in women over 50. Don't ignore ongoing discomfort. It's your body's way of saying something might be off. Let's recap real quick. Chew your food slowly and mindfully. Explore a low FODMAP diet to find hidden triggers. Sip herbal teas like peppermint and fennel. Add probiotics and fermented foods to boost gut health. Move after meals and maintain good posture. These small changes, when done consistently, can make a big difference in how you feel every day. If you found this helpful, make sure to hit the like button, subscribe to HealthFlow, and turn on notifications so you never miss a video on living better as you age. And if you've got your own tips or natural remedies for gas and bloating, drop them in the comments. I'd love to hear what's worked for you. Thanks for watching, take care of your gut, and I'll see you in the video.